Multidisciplinary Assessment 3 by Ella Johnston,
Marie Andreski, Eliza Minahan.
Ovarian cancer often has no symptoms, or if so, they are non-specific, including the following such as abdominal bloating, difficulty eating, back, pelvic and abdominal pain, fatigue and pain during sexual intercourse. These symptoms may not be severe enough for a client to assume there is a serious illness. Patient name, Julie Brown, and she is 53 years old with a family background of ovarian cancer, but she got it early. Julie was suffering from abdominal pain quite regularly within the weeks leading up to being diagnosed with ovarian cancer. At her age of 53, she originally thought she may be going through menopause. However, she then discovered some unusual bleeding, which led the doctor to do an ultrasound of her uterus, this resulting in the finding of ovarian cancer.
Our multidisciplinary team consists of a gynecological oncologist. My plan is to discuss with Julie treatment plans and methods to overcome her cancer. I will offer her treatments such as surgery, chemotherapy, and radiation. During the surgical procedure, if she chooses to have one, the cancer will try to be removed as much as the surgeons can. If surgery isn't successful, radiation's high energy rays are a way to minimise the growth and may even remove it. Being in surgery, it is obvious that the stay will be up to 2 weeks for recovery. This is due to regular tests and checkups to see how the treatments have gone. After Julie has had her radiation or chemotherapy rounds, she is able to be at home for her resting time. To be safe, Julie should sleep on her own and have minimal contact with other individuals due to the harsh chemicals that are used. Julie was fit and healthy and had no past medical conditions. This may help as there is nothing to complicate with the recovery of the cancer and the treatments. Once Julie returns from home after her treatment, she is then able to seek ongoing help to cope with her ordeal from other health professionals that are working together for her. Statistics have shown that if the cancer was first treated while still in the ovaries, there is a 93% chance that Julie will survive the next 5 years without any ongoing problems. Julie is sure that she will survive her ovarian cancer and has got a very positive mindset. She has goals such as staying as happy and positive as she can, staying fit and active, and to make it through the next 5 years without any ongoing problems as she is still very young. I will now pass you on to our radiation oncologist to follow on with more of Julie's case.
So I am Julie's radiation oncologist. The radiation oncologist plays an important role in assisting in the management and treatment of patients, such as Julie Brown with cancer, in particular ovarian cancer, through the use of radiation therapy. Having the responsibility of establishing a management plan for Julie, who is diagnosed with cancer, my responsibility extends to determining and prescribing the most appropriate dose of radiation as required for the particular patient and her current condition. Through the treatment plan, which is specifically designed for my patient Julie Brown, our radiation oncologist team aim for our patient to be treated in controlled measures over a duration of a number of weeks, allowing time for Julie to recover in between her scheduled appointments, as well as ensuring the cancer is specifically targeted. Working closely with other health professionals such as medical specialists, radiation therapists and nurses, as part of a multidisciplinary team caring for our patient Julie Brown, who is diagnosed with ovarian cancer and is undergoing treatment, helps ensure clear and precise communication with no information being misunderstood to not only Julie and her family, as well as other healthcare team members who are involved in her treatment process. I will now pass it on to the medical oncologist.
I am Julie's medical oncologist. I'm specialising in the diagnosis and treatment of the cancer using chemotherapy, hormonal therapy and biological therapy. I will be Julie's main healthcare provider for the duration of her cancer treatment. I will work closely with Julie to become her counsellor, manager and researcher. If Julie has anything she wants to put forward or has any questions to ask, I will be the one to go to. I will manage Julie's cancer by giving her regular updates, explaining diagnosis, prognosis and treatment plans. Our whole team will be working closely together as we all need each other's information from separate sessions with Julie to combine to allow us to be updated with her and how she's going in all areas of treatment. While she is in hospital, I will see Julie daily with updates on how her treatment is going and checking up on how she is coping and managing with her ordeal. With Julie's set goals, I will be there to help her achieve what she wishes. I will allow her to have the quickest recovery as she can and to get back to her old self. I will now pass you on to Julie's radiologist.
I am Julie's radiologist, and I specialise in obtaining and interpreting medical images in the process of diagnosing and treating Julie Brown. With the use of x-rays, MRIs and ultrasounds, I'm involved in the treatment process of patients such as those who are diagnosed with cancer. Involved in the treatment process of Julie, the use of medical imaging helps identify the area of concern. With her background in medical knowledge, enables the ability to understand and interpret what the medical images obtained show and any issues. In the case of Julie Brown, it is identified that her ultrasound results show that she has signs of cancer cells. However, further tests are needed to be taken for better and more accurate results and information. Communicating the results of the medical images, the information found are to be communicated and written in a report for Julie's doctor, as well as any other health professionals involved in her treatment process. I will now pass it on to Julie's cancer nurse.
As a cancer nurse, I'm trained in caring for people with cancer. My role is to be there as a support, assisting understanding of the disease and treatment options to Julie throughout her treatment. I have a number of duties towards Julie as my client. I will be reviewing the health history of Julie to have a better understanding of any previous health concerns if they're needed. During the treatment, I will monitor Julie's physical and emotional status, making sure she stays as positive as possible if she needs any other mental health support. I will also keep a track of Julie's laboratory and pathology results through collaboration with the multidisciplinary team about Julie's treatment plan. I will safely administer medications and cancer treatments. I will also suggest other healthcare professionals such as dietitians, social workers and counsellors who Julie may wish to see. A client who is suffering or has suffered from cancer can experience a number of side effects. Physical, emotional and social side effects are often linked to cancer. Depression, anxiety and distress can affect the way a patient returns to normal life afterwards. Patients and family members should share how they feel, as trained professionals from the healthcare team can provide coping strategies to help an individual through this difficult time. After Julie's rounds of chemotherapy and radiation, she is able to go home and rest and see her family and friends, although she is only allowed to have minimal contact with them.
We, as a multidisciplinary team, have worked together and collaborated on Julie's treatment plan. We believe, as we caught the ovarian cancer early on and hadn't spread out of her ovaries, that she will have a success in a full recovery and within the next 5 years will be out of remission and